Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. All right. Hello, Dr. Normington. How are you today?
Good morning, Jordan. We're great.
Good. So as we discussed before, breast augmentation is one of the most popular procedures you do at our practice here. What about for a patient who might not be interested in implants per se, but are looking to either lift or kind of reshape the natural breasts that they have been given?
Sure. So that's a very common concern. As women get older, the shape of the breast tends to change. Breastfeeding, aging all affect the breast, and this may lead to a little bit of drooping or sagging, and that might cause us to recommend lifting the breast. So this is a very common scenario, and in fact, sometimes I think we actually perform more breast lift procedures than we do breast augmentation procedures. So the goal of breast lifting is to reshape the breast to a more youthful position. And then we'll commonly at the same time add some volume with a breast implant if a woman is interested in more volume. I think the best way to approach that decision is I discuss with a woman how they feel about their breast in a push-up bra. If they're happy with the volume of their breast in a push-up bra, which simulates how things are going to look with just lifting alone, then we probably don't need to consider using breast implant. But if they're still a little disappointed with the size of the breast in a push-up bra, then we probably want to talk about adding volume with a breast implant at the same time during the lifting. And this is very common to need to approach the breast this way by adding volume and lifting at the same time.
Okay.
Yeah.
So for patients who are considering then lift as well as an implant, is the incision site the same, or is there a different procedure to
So the goal of a breast lift is generally to reshape the breast and remove the extra skin on the breast. So with breastfeeding or just with aging, it's very common for the skin on the breast to stretch a bit, and that allows the breast to descend. So the goal of the procedure is to remove that extra skin. So during the procedure, we measure how much extra skin there is, and that extra skin is removed. So there are incisions on the breast. They're all typically around the bottom of the breast, something that would be easily hidden in a bikini top, for instance. Most of our breast lifts are able to be accomplished with something called a lollipop incision. So that's a little incision around the areola, and then there's a vertical aspect going from the areola down into the crease sitting below the breast. So lollipop shape. And the medical term for that is a vertical breast lift. Now it's different for every woman, but generally that's the sort of incision that a woman can expect. But using those incisions, we're able to lift the breast upwards. And then at the same time, we can put a breast implant beneath the breast using that same incision.
Okay.
Yeah. So
in that situation, if they're also having a lift, do you still place the implant beneath the muscle, or is there a difference in where you place it?
In procedures where we're lifting the breast, generally the implant is put below the muscle. It's then away from the breast itself, and then with the healing and the surgery going on in the breast regarding the breast lifting, the implant is away from that. So it's just generally a safer situation for the healing process.
Yeah. And for like recovery time, is that about the same as a standard breast augmentation or?
Sure. So after the surgery, there's a little bit of discomfort. You might take pain medicine for a day or two. We have a woman wearing a bra for a few weeks just to hold everything in place. There are lots of stitches. They're all generally below the skin, and they all dissolve. So there's no real stitches to remove. And a woman will have some gauze pads in the cup of that bra that they'll change out, daily for a couple of weeks. There are some restrictions. For a few weeks, we ask that they avoid anything that's real strenuous or aerobic. So things like the gym and strenuous things around the house like yard work, things like that are out for a few weeks. But lighter activities can resume almost right away. And most women are back, with the typical job, most women are back working within a week. If you're working from home, unfortunately, you probably could get back to that almost the next day, working from home if you're real motivated.
Yeah. Do you have any other information that patients might need to know or have questions about usually during a consult, something that's normally asked by patients?
Well, I think there's incisions in the breast with a breast lift that are more visible than straightforward breast augmentation. So that's a common concern. I encourage a woman to either look at our website. There's a lot of before and after pictures that show you the potential incisions and scars, or come in for a consultation and we can, again, show you pictures and give you an idea about how things might look afterwards. So that's a common concern with a breast lift, is the scarring and how that affects the long-term look of the breast.
Yeah, great. Yeah. So where would a patient expect to have this surgery performed? Here at our office, or?
We have a licensed surgery center in the same building as our office, and that's generally where this sort of procedure is performed. So this is a licensed and accredited center. We have the same sort of safety measures that even a hospital might have. It's adjacent to our office. The nice thing about this center is it's very private. You don't need to worry about your name being posted in the hallway and a neighbor seeing it over at the hospital. And, it's very, very safe. We have, again, the same sort of safety measures available that you might receive really at any hospital in the area. The surgery itself can take a couple of hours to do the surgery. There's some preparation beforehand, then an hour or two of recovery afterwards. So the whole process might be 5 or 6 hours. Obviously, because of the anesthesia, you can't drive home, so somebody would have to give you a ride home and a little bit of a hand that day. And that person's welcome to hang out in our waiting room and make themselves comfortable, or also they could also wait at home, and maybe many people do that and just come back and pick you up later. So the nice thing about our situation is that we have an accredited facility where we just focus on performing this sort of plastic surgery.
Yeah. Well, thank you again for your time today, and we will see you next time.
Thank you.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology, or on Instagram at Lewisburg Plastic. We'll see you next time.